So whose name is well known to anybody in the cricketing field, the cricketing range. He is one of the pioneers in the shoulder surgeries and the knee surgeries, and his excellence was in the shoulder surgeries. Another man was from Australia, where I got again from further training over there, and to see much deep into the hospital. When we go to the special surgeon, they will look into the shoulder problem, something they will tell, yeah, you have got some pain, general pain or periarthritis, something, if it is in older people. But if you look into it, if you go deep, we have got many things to divide ourselves and to keep into one proper problem to fix it and to treat it accordingly. So we can treat accordingly only when the problem will subside. You cannot give for everything the same one medicine. So you will have to be different aspects in approaching. So that is what these people does it. They see, evaluate completely, and they differentiate what exactly is the diagnosis and then proceed with this. So Mark Ferguson and Peter Campbell, they are my inspirers to make my career further. And yesterday somebody, when I met in Jayanagar, when I met a doctor, she said you are very young. So I was really thrilled actually when she said that I am really young. Then I said, no madam, I am not young, I am a bit older only, but probably I am going to die. So looking into my experience, I got a vast experience in my shoulder and knee surgeries. And within the short period of time, I had loads of the surgeries which had given an opportunity for me. I was given an opportunity to carry out, and most of them are successful surgeries. That is because I had such a nice facility given to me. So previously I was heading the department of sports orthopedics and arthroscopy, one of the largest orthopedic centers in India. It is called MIOT. From there I shifted to the Fortis. So had an experience of about more than 5,000 surgeries done in the knee and shoulder, more than, now it is few little late figures, now more than 1,500, because the shoulder specialty is little bit more late, and we get referred less actually. That is the reason we want to educate and tell the people that what exactly is there in each specialty, so that we can refer to the referral specialist. So some of the quick my international players whom still I have not of, I cannot share few names with the people generally in public. So she was the Joshna Chinnappa, you might be knowing it, she is a squash player. Now she is number 2 in India now. She was number 1, of course, when she was playing in the US, she got injured. From there, she had to come down from there to operate. I had operated her, and now next is the big story. She's playing very well now. And is Darren Sami. And they are all national football players, and she is the national swimmer. And he is a young and enthusiastic now the forward player who is coming to the national football. So with this, I will start some of the things which you come across in your daily life when you are playing, or you might be noticing in your, when you happens to your friends or somebody. If you have got anything to ask me, or anything related to the problem, related to particular problems, you are fair and directly you can ask me. Anything in between, you can interrupt me and you can ask me, because there are a lot of things which I cannot be able to cover also, so that which can be interviewed in between and you can ask the questions about. Fine? And I'll just give the brief history of this one athlete. So what can happen and what would have been problems with this patient. So she is an athlete. She is a forward national athlete champion, and she was able to qualify for the Olympic. But she had a pain in the front of the knee. It was about almost 1 hour duration from 2014, and which has made her stop the career because she had a very, very bad pain. Imagine when you are all vaulting, how you will be old. They have to put and you have to jump against the wall with the pressure on the knee. So when they jump pressure against the knee, they will be the pain. So that was impeding to her future career. And of course, she had a good, she was evaluated very, almost 6 months completely in the US, not happy, not satisfied. She was not doing very well. And later she came back to me, diagnosed with the problem, what was not there in the MRI, was diagnosed by clinical examination. I will tell you what important is when we examine the patient without any just looking into the X-ray or MRI. Okay, she did very well with the surgery and she is back. Let's do the history. And have your mic in this? Sound is it? Can you do the sound? So if it's not there.
Improvements and she had to stop her career. Wakharia has been recently invited at World Athletics Center USA for the training which requires $55,000.
Like not really result in a single sponsorship, but I have now a strong network of family friends who are really helping me. My gymnastics club.
So that is, I'm sorry, actually could not able to get in the video. Yes, what she had the problem was she was not able to jump. So that was the problem. But when she went to the doctor, orthopedic surgeon, they evaluated and they said she has got a patellar tendinitis. Patellar tendinitis means what will happen is when you jump, it's called a jumper's knee also. When you jump, what will happen? The kneecap, below the kneecap there is a tendon, it's called a patellar tendon. So because of constant friction, that will be getting an inflamed. Inflamed means it gets swollen inside. When it gets swollen, you get excruciating pain when you are not able to jump further. So that is because of patellar tendinitis. So what happens inside the patellar tendon? See, if you see an MRI, you see an MRI. When you take an MRI, you can see down, few fibers can get tear. That is the one which happens. Plus, what will happen when it gets tear, there will be a reactionary inflammation, what will happen, healing process that will cause the fat tissues to grow more over there. So they will have a swell, they will have a swelling. When they get swollen, of course, next is that rest is they will not be able to play. That is what the picture, very good picture. So this is what MRI picture says about. So they thought that this is the MRI findings over there. They gave an injection, that is the PRP what injection. PRP is the things nowadays, if you might have heard about the stem cell therapy. Stem cell therapy means we take a cells from our own body, culture it and give it to the patient. So our body has got a potential to heal the particular problem. If you put those one cell to one bone, it will turn into a bone. If you put the same thing into the skin, that will turn into the skin. So it has got, it's just like a milk and water. Wherever you put it, will take into the shape of the container. So it is just like those stem cells that has got a potential to form into that particular an organ. So they try to put a PRP injection to that part which is not healed. Okay, done physiotherapy, not healed. With all these measures, she is not able to come back to the sports, and she had left the sports for nearly a year without taking part into any events. So, in that case, we should think that there is some problem still which is beyond, we are not able to see. What is it? That is what we have to examine. When we see the problem, we will come to know what exactly is there behind. We should not directly see a picture and tell about this person. We have to interact inside about the person to know the quality. So when we see, they examine the patient, I got to know there's some other problem which is, there is beyond the patellar tendinitis which is in an MRI. So that is what called as a Arthroscopy patella. That is, it is not the tendon itself will not be the problem. With the tendon behind there is a bone, that is the patella kneecap. Kneecap was getting more stress. When they jumped, the kneecap was taking lot of stress, and that cartilage of the kneecap, the patella, what we call, was softened. That is, it was getting ulcerated. When you keep pressure in one area, that area will become very soft. So that is what we call as a Orthopaedician patella. We can see how this is.
This is the track which should take place where that patella stays right in the groove in the camera space. Here we see the carolina, and we see the course of the tracking.
So when we see, you can see how the knee, when you bend, how it goes down. Imagine that is the bending position. When you bend and jump, that kneecap will have a direct stress on the thigh bone. Got it? So that is what we call, when it says constant injury, it will have the corner Malaysia potato. So how? As I said, clinically diagnosed. But we have to see what exactly is inside. Because MRI will not tell many things when we see in a picture. MRI gives only 95% clarity. And the remaining 5% is the one which you need to judge from your all expertise. So when I say it is Condom Malaysia Patela, she was a doctor. She herself was a doctor and she had worked with me for 3 months. After finishing this, she got confidence in me. Yeah, then okay, I can believe him, I can learn something from him. So she was there with me for 3 months with me now. And she is back to US again for further training. So that is what we put a camera inside because all her therapy was completely failed. She had physiotherapy, she had medicines given, injection given, she had a rest, everything was, when it was not giving her a good result, next was we need to see directly to put a camera inside and see what is the problem. So can you see that was the ulcer which has been created underneath the kneecap. So that we call as Condom Malaysia Patella. Here what we see is, we are seeing a laser. Okay, this laser, what it does is, it trims the cartilage which has come out of from its area. So thereby it will avoid further damaging and preventing more injuries. So this shrinks the cartilage which is come out. And it is not a which is devastating or more destructive surgery. It is a reconstructive surgery allowing for the cartilage to back to its place. So once if it is, you can see this, we are removing all the fat pad which was grown extra over there in the knee and the MRI. So this will help us in taking out the pain area. So it is just a laser area, can you see any blood over there? We are not seeing any blood. So this is called, this is the advantage of all the new therapies which has come, the chemo surgery, where the blood almost you don't see much blood inside over there. So you can see that is the one which kills, that will help to, wherever the pain area which comes over there, will burn that nerves. So that the pain creating nerves will be completely nullified. Okay? That is why we call as a knee, jumper's knee or the Condom Malaysia Patella, which we do regularly from our person who are the jumping, whether it is the pole vault or high jump or whatever it is. Okay? One condition I say. And second, much very common.